Thank you for having me here. Thank you for giving me the opportunity to talk 20 minutes about European funding, and European cooperation is also on the title. I'm going to give you the basics, what's out there to get funding, and then this day is also for you to find maybe project partners to then maybe submit joint applications for the calls I'm presenting today. I'm a so-called national contact point. This means I'm working at FFG, Forschungsförderungsgesellschaft, Austrian Research Promotion Agency in English. This is a big national funding body, but it also has a big unit advising on European programs, and this holds national contact points for each part of Horizon 2020. And you also have these national contact points in the UK, in Germany, in Switzerland, so they're all over Europe. And we are there to give you advice on how to apply for Horizon 2020. So what am I going to talk about? Give you a brief introduction to Horizon 2020. It's a very political program, so I'm going to set the scene on the political background. Then which calls are out there at the moment, some examples, and then what support can you actually get by an NCP? So can I ask who knows Horizon 2020 in the audience? That's perfect, so I don't need to set much of a scene. So you all know the basic structure. This program has been running since 2014. Our main focus today is on the so-called societal challenge, health, demographic change and well-being. It's a very big challenge, budget-wise. It's the biggest one of the societal challenges in Horizon 2020. And I've also marked another program. It's called ICT, Information Communication Technologies. But actually all parts of ICT related to health, they have moved into this societal challenge, health, demographic change and well-being. So that's what I'm mainly going to talk about today. Since you're all experienced, you know that all the calls I'm talking about are top-down. They're defined by the European Commission in cooperation with the member states and with the countries. And top-down means that once a year a call is published. It contains so-called call topics, we call them, and all these call topics always have the same structure, which I'm showing here. It's always a specific challenge which describes the problem. It's always a scope which describes what you're actually supposed to do with your team in your project. It gives you a budget indication, how big should each project be. It lists the expected impact, which is very important because you're doing this project to achieve something in the end, to have an impact on society, on health care, on medical level, on patients, for example. And it always defines the type of action. This means, is this a research project, a so-called research and innovation action, or is this a coordination and support action, which is more for coordinating, networking, supporting roadmaps, etc. So this is always the basis for your application, so you should really read this text very carefully if you think about applying. So most of you will know that for these projects, for these collaborative projects, you need minimum 3 partners from 3 different EU or so-called associated countries. Horizon 2020 is open to the world, so everyone can participate, but not everybody gets funding. Yeah, and this funding, who gets funding, this is divided into country groups. So the first group, obviously, EU members, associated countries. This is like Switzerland, for example, Norway, but lots of West Balkan countries, for example. And also the so-called low-income countries. They all receive funding and are eligible for funding. Any other industrial countries or so-called emerging economics, for example, BRIC, Brazil, Russia, India, China, and Mexico. In principle, these are not eligible for funding. Mostly they have to find their own resources to participate in these actions, but lots of countries have co-fund mechanisms to participate in these calls. And in exceptional cases, they can also receive funding by the European Commission, by Horizon 2020. For example, if you can prove that this partner is essential for the project And there's one big exception for the calls I'm presenting today, and that's the United States. In health, these are also eligible for funding, just like European countries. So you might ask me this later, what about the UK? Obviously now it's a EU member state. None of us knows at the moment what's going to happen in the next month. The absolute worst case scenario is a no-deal scenario, in which case the UK becomes a third country, like the other industrial countries, and then is not eligible for funding anymore. But as you've heard, the government from the United Kingdom is promising to keep the funding going. So even in this worst case scenario, there's a so-called underwrite guarantee by the government that the funding will be provided nationally then. In any case, the calls I'm presenting today have deadlines in autumn or next year. So by this time it should be clear what's happening, and so for now, just really continue to plan, as always, include British partners in your consortium. I'm sure there's going to be a good solution for all this, because it is one of the countries receiving the biggest funding also in health. So I've mentioned it's a very political program. This is a list of all the policies that are running in the background, defining what's out in these calls. It's really very strategic, very political. The European Commission is, especially in health, connected globally all over the world, addressing also global issues like infectious diseases, and is connected in a lot of collaborations, policies worldwide. So this is a big list. You don't need to read through all of this. I just highlighted two which are important in today's context: the digital single market strategy and the communication on digital transformation of health and care in the digital single market. And on this one I'm gonna have a couple of slides, because this communication is basically the basis for lots of calls that are in the next year's, lots of topics that are in the next year's calls. So the basis was in April 2018. There was a big data package presented by the European Commission, and one part was this communication on digital health and care. You see a nice picture. I'm not sure, you can probably not read it because it's too small. In any case, you're going to get all the slides afterwards for your at your disposal, and you can look at more details. So it's got three main pillars, this communication. The first one is to give citizens better access to their health data everywhere in the EU. The second one is to use digital services for citizen empowerment and person-centered care. And the last one, to connect and share health data for research, faster diagnosis and better health outcomes. This is also a lot with genomic data and personalized medicine. So these three pillars are really very important, as I said, for the definition of the call topics, because that's what the Commission wants to achieve in the next years. And you really cannot read this, sorry. These are just a few key words coming out of this communication. You're going to recognize them again when I present you the call topics. Since you can't read it, it's like pilot actions on rare disease data, coordination of data sharing and infrastructure for personalized research, secure access and exchange of health data, a European exchange format for electronic health records are some keywords. This I didn't, of course I'm not going to read it all out to you, just to show you there's some very nice infographics which you can look at explaining this approach to digital health and care. The other focus we've got today is on artificial intelligence, and again, whatever calls I'm going to present you, there again is a strategy in the background. Lots of countries are developing artificial intelligence strategies, and also the European Commission, of course, as a joint union, is developing approaches here. There has been again a communication on a coordinated plan on artificial intelligence. There's again a very nice info sheet on this, and of course one application of artificial intelligence is in the health area. So with this I was setting the scene just to show you that all these topics I'm presenting now have a source in politics, in policies, and in European strategies. So what's open right now in the next year, in the next 2 years? The last 3 years of Horizon 2020 are running, and this is a joint approach, always for 3 years. And these are the 7 priorities at the moment. For these last 3 years: personalized medicine, innovative health and care industry, infectious diseases, global health, innovative health, integration of care, the role of environment for health and well-being, digital transformation in health and care, and trusted big data solutions and cybersecurity. And I've put an arrow on these last 2 because that's the topics I'm going to briefly list for you. So very last minute, if you want to join this, you cannot start from scratch. If you are interested in this topic and you want to join somebody, this is ending in April, this call. So I thought it's very interesting if anyone hasn't heard about it, but in this case you have to try to join in somewhere. It's on big data and artificial intelligence for monitoring health status and quality of life after the cancer treatment. So research and innovation action, and the deadline is the 24th of April. So I've always listed on the slides here some information on the topic. I'm not going to read it to you, that would be too boring, because I'm going to present you 12 topics. My purpose is just to give you an indication what's out there in the next year. If you see any title that sounds appealing to you, just keep it in mind. That there's something out there. You can contact me or your national contact points in your country if you want to know more details about it. So the main call I'm talking about today is the call 2020, so the last call in Horizon 2020. The publication is foreseen for June, but there are already draft versions out there, and if you want to have access to this, you can email me. There are always in health 2-stage calls and single-stage calls. This means a 2-stage call, you write a short application in a first stage of 10 pages, and then if you're successful, you're invited to write a full proposal in the second stage. So the 2-stage calls actually already have a deadline in September this year, so this is approaching fast. For any single-stage calls I'm presenting, and that's mostly the case, you have a bit more time. This is April 2020. So I've listed 12 topics which I thought are interesting. As I said, I'm just reading you the title and not the whole scope. The first one, and this is a 2-stage call, so September, digital diagnostics, developing tools for clinical decisions, integrating various diagnostic data. It's going to be a research topic. It's going to be around, I think, 10 million per project. That's not defined yet, and there are 40 million in total for these projects. So in most cases, several projects will be funded per topic. The second one, personalised early risk prediction, prevention, and intervention based on AI and big data technologies. 4 to 6 million per project. As you see, I've always written the total amount that's available and the amount that's foreseen per project, so you can always calculate roughly how many projects will be funded for each topic. The next one, accelerating the uptake of computer simulations for testing medicines and medical devices. Again, a single-stage call. So I'm going through this quite fast, but I know from experience that reading all details to you is always too much. Use of real-world data, that's a bit of a new term, don't know if you're aware of this. So this is, it says these are data not coming from pharmaceutical clinical trials, so anything else, any other observational studies or apps you're having or something like this. This is real-world data in the definition of the Commission. So use of real-world data to advance research on the management of complex chronic conditions. Again, a research and innovation action. Implementation research, it's also a bit of a Commission term, for scaling up and transfer of innovative solutions involving digital tools for people-centered health services, a very long title. So implementation research means there's already something available you've developed and you want to scale it up to be of use for more people. And then some coordination and support actions. These are smaller projects, and in lots of cases only one is funded. These are always to fulfill certain policies, certain roadmaps, and to support the Commission in implementing these policies. For example, support for European e-health interoperability roadmap for deployment is one. Scaling up innovation for active and healthy aging. Supporting deployment of e-health in lower and middle-income countries in Africa. As I said, there's often a global focus in these topics. And towards a health research and innovation cloud. So the topic of cloud is for sharing data is also a very important one. So the last three topics, they're quite new. They've only recently come into these calls. In case you've seen earlier drafts, these are new topics. Following on this AI strategy of the European Commission, all of them research and innovation actions. The first one is AI for the smart hospital of the future. The second one, AI for genomics and personalised medicine. Lots of description always in the topic text, what's expected here. And the last one, AI for health imaging. And before you get too excited, I just want to mention that this is focused on cancer only. Yeah, I know there are lots of people working on other imaging applications. In this case, also to avoid a very high oversubscription, this is on cancer imaging only. But I guess there's still enough out there, enough research going on. So this was an overview on the topics and how you find project partners here today, for example. But if you're not using today, use existing other networks. You can search, it's very cumbersome work. And also on this funding portal of the Commission, you can register. Every topic has the opportunity to register your expertise profile if you're interested in this topic. On my next two slides, I've just listed some examples of what's being funded in the last few years. I just did a quick search, digital health projects with Austrian partners. For example, one on machine learning, blockchaining for reduced cyber risks in a world of distributed healthcare. Runs for 5 years, receives for almost 5 million, coordinated by Munich, and has additionally Austrian and German partners. Or this is one coordinated by the UK, also includes an Austrian partner, securing medical data and smart patient-centric healthcare systems. So all these projects, there's a project database, you can look at all of them. They have websites in case you want to get an idea, okay, I see these topics, but what's an actual project like? Yeah, who's in there? What kind of partners are in running projects? How much money do they get? For example, the next one, the last one here received 22 million euros. That's a very big amount. 18 partners in total on EU, so electronic health record exchange for personalised health. So I have to finish, 1 minute. Just want to show you that the countries we're talking about today are already collaborating. For example, I looked at the projects coordinated by Austria in health. So we have 9 projects so far coordinated by Austria. It has a total of 103 participants. Most often the cooperation partners are from Germany. That's probably a language thing between Austria and Germany, makes it easier to cooperate. But also 4 times United Kingdom, 5 times Switzerland, and an additional always partners from Austria. So collaborations are ongoing. And lastly, I want to show you, if you come from a different country, how do you find your national contact point to give you advice. Again, on the funding portal you have this support. You can search for a country and for the area, program you're looking for, and what kind of services do these national contact points offer. In our case at FFG, we have events, we participate in events like today, webinars, newsletters, homepage, and with the focus, of course, on Austrian clients. Our main job is to consult, to project ideas. We read the proposals, we give very hands-on trainings, how to write a proposal, lots of webinars, and a lot of other services to use. And this was it, I hope, on time, and see you in the panel discussion. Thank you.